Welcome, and thanks so much for joining us today. One of the major issues with the whole COVID-19 situation is anxiety and the anxiety that it's created around life in general. And this has been the great equalizer because it has affected every single person in one way or another in the United States, whether someone got ill, someone got ill, or just in general, where we work, how we work, where our kids go to school, how they go to school. Everything has been affected. If we said a year ago that we would all be walking around with masks, people would tell us that we were crazy. That would never happen. And yet, here we are. So we know that nationwide, and actually there was an article published in JAMA recently, which is a major journal, saying that the numbers of cancer diagnosis has decreased in several countries. We don't actually think that the number of cancers has decreased. It's the number of diagnoses. Why? Because people aren't going for their screening, unfortunately. So today, that's really what we would like to discuss. And it's so interesting because we can set all of these motions in play as to how we take care of cancer patients during COVID. But if we cannot get patients to the facilities to be screened, those protocols really don't help us. And I'm very familiar with them as I co-authored the protocols for taking care of breast cancer patients during this pandemic. So I'm lucky enough today to have Amanda Miller along with me here. And as I say all the time, everyone should have 1,000 Amanda Millers in their life. Aww. So Amanda, I don't know if you've heard me say that, but I definitely say that. So Amanda, tell us a little bit about what you do and your experience with this.
Yeah, so thank you for that. So I am a licensed social worker in the state of New York. I'm working at the breast center alongside with Dr. Vogel. And we have been seeing this impact that this pandemic has had on our patients since really February, March, the beginning of all of this. And it's really, as you say, it has been affecting everybody, regardless of whether you are the patient or if you are working in the office with us. So I think today's call is really important to address the importance of early screening and having your wellness checks, having your preventative screenings to make sure you are healthy and up to date on everything. I personally have a background in mental health. I've been working in mental health for over 7 years, so I've seen the range of anxiety, how it affects people from, whether you're able to manage without medications on a day-to-day basis, or some people it can be so crippling. So.
Yeah, I mean, one of the issues is the feeling of, I know I'm not taking care of myself. I just don't know how to get there. And I'm too anxious to go in and have my screening mammogram or my colonoscopy, or even go to my primary care doctor. How do I know as the patient that the office is taking the proper precautions? And how do I go about figuring that out? And what are the proper precautions?
Sure. So that's a great question. And I think it's a great first step to help make you feel safe and make you feel prepared to be able to take that step to come to your appointment. So perhaps first and foremost, you can look up your healthcare facility, look at what steps we are taking. You can even give us a call and talk to us, because we would be more than happy to let you know what we've been doing and to reassure you. I can speak to what we've been doing at New Vance Health.
Mm-hmm.
Obviously, we've been taking this very seriously, with Vassar Brothers being one of the hospitals designated to take care of patients during the pandemic who have been affected by COVID. So a couple of the steps that we've been doing: you will get a phone call from a staff member the day before your appointment, and that is your initial screening. We make sure that you don't have any symptoms, discuss whether you've had any fever, a cough, shortness of breath, anything like that. After that phone call, the next day, First, you may be asked to pre-register, and the idea is to, again, reduce the amount of time that you are sitting in the waiting room to reduce contact with other people. You would be asked to call us from the parking lot, and we're referring to this as our virtual waiting rooms. So that way, your check-in process starts from the moment you arrive in the parking lot. And the importance of that is you're still in the safety of your own space, your own car. Once you come to the facility, we check your temperature at the door of the facility as well to, again, screen right then and there, make sure everybody's safe for yourself, for ourselves, for the community around us. When you come up to the office, we have specific seating available for people. So some seating is taped off, and that's to ensure that there's proper social distancing in between each patient. But again, we are trying to limit the amount of patients sitting in our waiting room. So we make sure that the room is prepped beforehand, and we'll bring you in. And then when you're in the room after your appointment, we clean the room in between every patient as well. And obviously we ask that you come in and you wear your mask when you come to the facility, and you're washing your hands and the whole 9 yards. So.
Yeah, I mean, I imagine you had to work throughout the peak of the COVID-19 crisis. How did you feel about going into work every day? Were you then nervous about coming home to your family?
Absolutely, absolutely. And I think that's really a normalizing factor, is that you're, as a patient, you may be worried, but we as the workers are also very worried. I have two small children myself, 1 and 2 years old. So obviously
You're pretty busy.
that fear. Yes, very busy. They keep me out of trouble, so it's good. But yeah, I mean, I was always afraid that, will I contract this? Will I bring that home to them? So that anxiety is across the board for all of us. Personally, what I did was, it's a lot of bringing your mind and your thoughts back down to the present moment, taking each day at a time. We don't know what tomorrow is going to bring. And I don't know about you, but my thoughts can really snowball out of control if I start to let them go that way. So I stop them and I say, how many times have I thought of things and worried about things and have them not come to fruition? So reminding myself about that. And actually, I kind of almost played a game with myself where every day when I did a temperature check on myself was another day that I was well. So kind of trying to do a little bit of thought reframing almost around it. So,
which is so important, not just for this, but for everything. And I know that there are patients that are not happy with some of the steps that have been put in, such as you cannot bring someone with you to the appointment. But the amazing thing is, as soon as we explain that that's for their protection, because we don't want an increased number of people in the office, but also for our protection so that we can continue to be healthy and come to work and take care of them. But that we will go through every step possible to have their support person included in the visit, whether it's calling them and having them on speakerphone or FaceTiming them, or however we have to do it. I think that everyone's willing to do it, because this, as I said in the beginning, is the great equalizer. We are all in this together.
Right. Exactly.
So, right. And without that, that is an attitude and a thought that we do have to keep in mind.
I think it's also important to remember too, so it's difficult when you're the person going through it and you're thinking, I can't bring my support person with me, I'm so nervous. But then when you kind of address it and say, well, we're trying to do that across the board with every patient, because when you think of it that way, if every patient was bringing in a support person as well, suddenly our office looks much different. There's so many more bodies available, and that means you're at a much more increased chance of getting this. So again, just to reduce exposure for everybody, for our patients, for ourselves, for the community that we're in.
Yeah, and I think that's an incredibly important factor. So we know, and in our offices, we've seen patients who come in, for example, if we're talking about breast cancer. We've seen women who come in and say, I found this mass in February or in early March, and I was just too afraid to come in and do anything about it. And if it turns out to be cancer, Amanda, what are you seeing in how they are dealing with a diagnosis such as that today compared to what they would have felt a year ago?
Right. I have seen that. I've heard people say that because of the pandemic, they're saying, well, I do feel this, but maybe I can hold it off another year. And it's interesting too, because I also see other people who maybe with their anxiety, it drives them to want to come in and get that treated. But yes, we're seeing that people are really delaying and putting it off and thinking, oh, well, maybe it's not anything real important right now, or, maybe I have a little bit extra time to kind of put this off. I think it's really important for us to really address to people and stress to people that please come get your screenings, get that assessed right away. It's so important. Early detection is so important. We see it in the office every single day where patients, if they get a diagnosis, we can catch it immediately and immediately start treatment for you. And there are so many options available to you. So we've really come a long way. And I think that anxiety of that fear of what's going to be found from this test really stops people from getting the treatment. But I really want to reassure you that we're here. We have so many options available, and we have an entire staff to support you throughout this journey too.
Yeah, the team is really, for any cancer diagnosis and for healthcare in general, it's the team that really matters. I mean, it's the physician, of course, but it's the entire office, because all patients have to feel comfortable there. And that starts from the moment you call through every touch point. And that's many people that are involved in your overall health.
Exactly. Even our front staff, our front of office staff who answer the phones, they're so important because they're the people that you first see when you walk in that door. They're that smiling face that you have to read through their eyes at this point through the mask, but you still get that sense of warmth from them. And I mean, when you come to us and we become a part of your team, we become an extension of your family, essentially.
Yeah. I mean, I think that one of the takeaways for this pandemic that we're in is also self-care in general, the big picture of self-care. Obviously, our healthcare is included in that. But what are your takeaway messages for anyone watching this?
Self-care is so important. I remember I learned about this in school, and I remember thinking to myself, I would roll my eyes and say, oh, self-care again, But really, as I've gone through, my journey, my career, it is so important for each and every one of us, regardless of where you work, regardless of what you do. It's so important to take care of yourself, whether it's coming to your doctor's appointments and getting your screenings, whether it's getting up and taking a shower. I know personally, if I go too long without taking a shower, I don't feel good. So it's really important for us to take care of ourselves in the simplest of ways. And it's so easy for our society. We're so quick, we go to work, we get up, we go to work, we take care of other people, and we really have a hard time taking time for ourselves and slowing down. And that self-care is really, it's so important to take some time out of, whether it's your day, your week, even set an hour aside for yourself, even if it's for a week. Set that hour aside, and what do you want that hour to look like? Whether it's going to a yoga class and taking that time to breathe and be in the moment, or going out and going for a walk, getting some fresh air and some sunshine, anything that is important to you.
Yeah, I think that you've highlighted something really important, and that's the issue that self-care really means different things to different people. For someone, it may be getting a massage. For someone else, it may be sitting down and having that 30 minutes just to watch your favorite reality TV program or curl up with a book. So it really is something different to everyone. And there's no recipe book for it. It's figuring out what it means to you and then ensuring that you fit the time in your schedule to do that. But
Exactly.
what is important is that we all take care of our health throughout this crisis and at all times.
Right.
You know,
Right.
I think that it's about our cancer screenings, our breast cancer screening, our colon cancer screening, our skin cancer screening, all of these different screenings, you know, that this pandemic has caused all of us to really stop for a moment, at any moment along the way. But at some moment, we've all had to stop and just take a breath. Unfortunately, cancer does not stop. Cancer does not know there's a pandemic going on. And therefore, it's critically important to continue to get those screenings. Any closing words of wisdom, Amanda?
Yeah, I think what you touched on is very important, that, perhaps the patients sitting home and saying to themselves, I don't have time for this right now because I have to take care of so and so, their loved one in their life. And something that we want to reiterate too is that you have to take care of yourself first before you can take care of other people, because God forbid you weren't around, who else would be there to
Right.
take care of that person?
Right.
So, yeah.
And it's not something we want to think about, but that is the reality, and that's what should be the driving force
Right.
to really take care of ourselves in a healthcare way.
Exactly. As we say, you can't pour from an empty cup. So to take care of others, you need to make sure that you yourself are well as well, whether it's having your appointments and being up to date on your screenings, and also really taking care of yourself, getting that little piece of self-care in to nurture yourself.
Well, I might have to quote you on that saying. I
Okay.
like it. I like it. So that's a great note to end on. Thank you, everyone, for joining us today. And please, please go get your screening mammogram, your colonoscopy, your skin cancer screening, all cancer screenings. And please remember to take care of yourselves today. Thank you.
Thank you.